how there isn't a sort of a quality mental health institution in the northern parts of India. There's also some mention of a considerable size of caregivers skill upgradation and
True.
employment guarantee. There also appears to be some mention of Ayurvedic medical institutions. How do you view all of this? Of course, we are well past COVID, which really saw the sort of historic highs in the health sector allocation. But do you see this as a sort of again, as a lot of what others have been mentioning, do you see this again as a piecemeal sort of allocations, or are they substantive? And what are you also hearing from the ground?
So the first response from the ground says that they're happy with the allocation where geriatric care is offered now to 14.9 crore people, which is the population that we have of the elderly who are over 60. There is strengthening of capacity building for allied health services. There is the biggest positive impact has been a
Yeah.
reduction of cost for cancer drugs and rare disease drugs. That is the most immediate impact that it will have. However, health sector has remained on the margins of the union budget. So there hasn't been any major allocations. Though again, Ayush is welcome. Mental health programs that are being brought in, that is welcomed. Strengthening of our drug testing capacity has been welcomed. Providing employment in form of allied health services, that has been welcomed. Another
Yeah.
major promise that the union finance minister has given is that there will be a trauma center for every district, which is 800 plus districts across the country. So that's a welcome move. However, health budget doesn't take into account the inflation that has been brought in and the sheer cost of hospitalization. This is apart from the Ayushman Bharat scheme or the government run health insurance scheme.
Yes.
So that is a sector that has remained completely untouched. So out of pocket expenditure doesn't look like it is going to go down anytime soon.